Let's talk about the Rwandan healthcare system. First of all, the economy. Looking at about 12 million people with a per capita GDP of between $2,500 and $3,000. So it's a poor country, but they've been growing steadily by about 8% for the past few years, with a very, very exciting economy with a lot of potential. 75% of the population right now is agrarian, making their living farming. But that's slowly shifting to other things. And really there's a huge amount of potential. About 60% of the population is under the age of 25 at this point. The birth rate is under control. There's an excellent infrastructure being put in place. The economy seems to be going well. Okay, so Rwanda really has a great deal of potential. What you do have to get, though, is that right now what's being spent is about $50 a head on healthcare. Right, that represents 7 or 8% of the GDP, but still it's not a lot of actual money right now. On the other hand, the Rwandans are getting excellent health care for that. The overall healthcare market is about $160 million worth of imports, but it's hard to divide that up right now in terms of what's medical devices and what's other stuff. A lot of it is generic drugs. Again, they're working at trying to provide health care with a relatively low amount of money to a lot of people. The government is committed to giving as the best quality health care they can, and they don't really have a lot of money. The system is not dissimilar for what you're going to find, for instance, in Kenya. You have regional health centers, about 500 of them, and they're going to give you a first level of support spread out around the country. And then that goes up through different stages to hospitals. There are about 42 public hospitals. And what's going to happen is people will have their first level of primary care, a local nurse, possibly doctor, midwives, that kind of thing, that are taking care, looking a lot at preventive medicine to begin with. And then that shifts up as they need it through higher levels of care throughout the system. There are 4 national referral hospitals. King Faisal Hospital actually has a branch here. So there are really different levels of support, of clinical support, from the little village clinics all the way up. About 60,000 healthcare workers serve in the villages, making sure that people get primary care, vaccinated, midwife service, that kind of thing. There is private medicine here. Probably less than 10% of the treatments are being given with private medicine, but of course the spending is going to be higher. A lot of that's going to be expats, a lot of that's going to be the richer part of the population. When you take a look, we still see that communicable diseases are big killers here, okay? 32% of the hospitalizations in Rwanda come from malaria. About 25% come from infections that probably in other places might be controlled with antibiotics. There's a serious shortage of clinicians here, with about 0.13 doctors per 1,000 population, about half a bed per 1,000 population, half a hospital bed, and about 0.3, 0.4 nurses and midwives per 1,000 of population. Because of the limited number of clinicians here, and really that's a strategic problem that the Ministry of Health sees, they've started a partnership with multiple training institutions, medical schools and nursing schools in the United States and in Europe to really try and provide a 7-year initiative to try and really triple the number of clinicians available in the Rwandan market, and that seems to be going very well. So eventually there should be a great deal more clinicians available in this market. Only about 30 to 40% of the population have access to plumbing, to toilets. So things that are going to control waterborne diseases, things that are going to help you with clean water, those type of things could be attractive to the market here. Things that are going to be able to provide medical care in small hospitals with less clinical support, less clinicians. All those type of things are things that could sell well here. One thing I'm going to tell you is very often, while there are distributors that are solely Rwandan, what I've found is many of the companies that have strong bases in Uganda, Tanzania, and Kenya have offices here. So I've worked in different years with people based in Tanzania, based in Uganda, and based in Kenya, selling in Rwanda. I've actually never worked specifically with just a Rwandan distributor. And depending on what you sell, this might not be a market that you want to put a lot of time and effort into. If you sell something that really fits this type of market, a poor market that needs to decentralize its health care, then this might be a fantastic market for you. If you sell higher-end products or more expensive products, or you're in direct competition with Indian and Chinese products that are significantly cheaper than you, this might not be a market that you want to invest a lot of time and effort into. But if your Kenyan or your Ugandan or your Tanzanian distributor can cover this for you, then that could be a cost-effective way of looking at it. Like you're going to see in a lot of East Africa, you're going to see a presence of Indian distributors here. A lot of the distribution companies from East Africa over the years in the medical business and in a lot of other machinery businesses and stuff like that have seen Indian merchants in the market. So very often you might find that your distributor here may be an Indian partner and a local partner. Of course, there is a registration process for healthcare products, pharmaceuticals, and medical devices in the Rwandan market, but it really isn't problematic especially if you have FDA or CE. You can get through the process, and there are plenty of people who can help you. Typically, your distributor can get that for you. Remember, when you're ready to grow your international sales, reach out to us. We can help.
When you decide it's time to grow your international sales, call us.